Meeting call to order.
Good evening, everyone. Hello. Today's I request President Rotarian Lal Goyal to confirm the minutes of the previous meeting.
The previous meetings minutes were circulated to all our members, and as we have not received any objection or observation, I presume that everybody has confirmed. So I hereby confirm the minutes of the previous meeting.
We are privileged today to have our guest speaker, Rotarian Dr. Girish Trivedi. Our topic today is organ and tissue donation. To introduce the guest speaker, I request Rotarian Dipin Shah.
Yes. Rotarian Dipan Shah, please.
Rotarian Dipan Shah, please unmute and introduce our guest speaker.
Hello, thank you so much. Good evening, India. Good morning to America. Thank you, Mr. President, and fellow all Rotarians. It's my pleasure and honor to introduce Rotarian Dr. Girish Trivedi. I'm very impressed with his noble cause. So he is the counselor for organ donation of Rotary District 3141 Mumbai. He is the founder trustee Aid Combat International, an NGO working around the clock for supporting people in need of medical assistance. He believes that awareness and motivation are key factors to increase the number of eye, retina, skin, musculoskeletal tissue, ligament, tendons, bone marrow, and placental tissue. He has included 1978 eyeballs. The eye donation calls have slowed down during the COVID era. In spite of the COVID restriction, he has managed to coordinate for about 54 eyeball and creation 27 eye donation clause. It's very generous and noble clause by Dr. Trivedi for his wonderful noble cause for the community. It's my honor to introduce and welcome Rotarian Dr. Girish Trivedi. Please.
Thank you for that nice introduction.
Yes, my pleasure.
We can start it, sir?
Yes, please go ahead.
Good evening, all of you, all Rotarians and other fellow members who have joined this meeting. First of all, I would like to thank Rotary Club of Organ Donation for giving me the opportunity to speak on a very important subject. Because as you know, the demand is on the higher side and what we get is on the lower side. There is a big difference when we come to getting corneas, when we talk about skin donation. There are long queues, people waiting for cornea transplant, people waiting for skin grafting, people waiting for a kidney transplant, liver transplant. So this awareness plays a very important role. And awareness along with motivating the family members to donate is the key factor to increase the number of donations. So we at Rotary give a lot of emphasis on awareness, and we try to see to it that each Rotarian plays a very important role when it comes to eye, skin and organ donation. First, we will talk about living donations. As you all know, when we are alive, we can do certain donations. The most common is the blood donation. As you all know, blood donation can be done every 3 months. There are certain criteria. Your hemoglobin should be on the higher side, more than 12.5%. Your age should be up to 60 years. You can do blood donation. And then you can do platelet donation. Platelet donation, a lot of people go to Tata Hospital and do platelet donation. Then we all know that we have 2 kidneys. And you can donate one of the kidney to your family members if he is into kidney failure. Then you can donate part of your liver. So these are all the donations which can be done when the person is alive. So we are talking about donating things once we leave this world. So the most common donation is eye donation and skin donation. And everybody should have the knowledge about eye and skin donation, because once you are aware about eye and skin donation, you will know that these are the simplest of donations. You have to just give a phone call to the eye bank, you have to call the skin bank, and the rest of the things will be done by the attending doctors, attending technicians. But the key factor is about the time. A lot of people know about eye donation, but when the time comes, we miss out a lot of eye and skin donation. So first we'll talk about eye donation. Eye donation should be done within 6 hours of death. Once the person is dead, he is certified dead by our family physician, or if the person dies in the hospital, they declare him dead. Then if the family wants to donate the eyes, the time is 6 to 8 hours. We have the time. Now, this is a big time. You can easily contact the eye bank. The eye bank people can come and do the eye enucleation and all. So the time factor for both eye and skin is 6 hours. The most important thing is the death certificate. Once the person is dead, you have to first make arrangement for the death certificate. You have to tell your family physician, family doctor that you first make the death certificate. We are willing to do eye and skin donation. Without death certificate, the thing will not move further. So once we get a call, once somebody wants to do eye donation, and when we get the call on the phone, mobile, first thing we ask the family is to send the death certificate on the WhatsApp. So once we receive the death certificate on the WhatsApp, we send it to the eye bank and skin bank. And if all the things are in place, if it is a natural death, there is no complication. I will come to that part later on. If all the things are in place, the eye bank will arrange for the team, and the team will reach at the earliest to the family, to the person's house. Or if the person has died in the hospital, they will reach the hospital. So death certificate is very important.
One moment, please. Yeah, please go ahead.
Okay. So once the death certificate is okay, the eye bank will send the team to the place, and they will do the needful. Now, there are certain things which always keep on coming in the mind of the family, people in the society. Who can do eye donation? Any person between the age of 1 month to 80 years can do eye donation. Age, age is not a barrier. You can do eye donation up to 80 years. After 80 years also, if somebody is willing to donate, then the cornea quality will not be so good, but the other part of the eyeball can be used for therapeutic study. But ideal age is from 1 month to 80 years. Person who is diabetic, who is suffering from blood pressure, who has undergone a cataract surgery, who is wearing thick glasses, the family members can do the eye donation of this type of people. So these are some myths which are prevailing in the mind of people. Eye donation can be done of all this group of people who suffer from diabetes, blood pressure, who have undergone a cataract surgery and all. It takes 15 to 20 minutes to remove both the eyeballs. And now with the latest techniques, we only remove the cornea. We don't have to remove the whole eyeball also. So it takes only 15 to 20 minutes. And after removing the cornea, they put proper packing in the eye. They put cotton, they put plastic lid. So there will be no disfigurement of the face, no bleeding, no problem during cremation, no disfigurement of any part. So people think that the person will be blind, we will be born blind the next birth. These are all misconceptions. Nothing is going to happen. You are going to give sight to 2 corneally blind people if you do eye donation. One more thing you have to keep in mind, by doing eye donation, you will be giving sight to people who are corneally blind, whose cornea is damaged. People who are suffering from glaucoma, who have retina blindness, we cannot do much for them. We are going to help out people with eye donation who are having corneal blindness. And unfortunately, India is harboring almost 2.5 lakhs of people who are corneally blind, and they require a cornea, and cornea will be available if somebody does eye donation. The cornea which is enucleated, or the eyeball which is enucleated, is sent to the eye bank. In Mumbai, we have a lot of eye banks: Rotary Eye Bank of Borivali, Sayyara Eye Bank at Bachuvali Eye Hospital. And people who have a person with corneal blindness in their family, they have to register the name with the eye bank. And when their turn comes, they are in a queue. So when their turn will come, the eye bank will inform the family member that we have received a cornea. They will take the cornea, and the cornea will be transplanted by a cornea surgeon. The process is known as keratoplasty. So the thing which we were going to burn or bury, that will give sight to two corneally blind people. And with the latest technique available, we can now split the cornea into two. So one eye donation can give sight to 4 corneally blind people. So this is a great humanitarian thing we can do. So all of us should motivate family which are known to us to do eye donation. If there is a death in the society, in our friend circle, in our relations, then you should always tell them to do eye donation. There are certain things the family have to keep in mind before the team of doctors or technicians come to their place from the eye bank. They have to keep a pillow below the head. So when the eye inoculation is done, there will be very minimum bleeding. They have to put off the fan and put on the AC. So the cornea will not dry up. And they have to put wet cotton after closing the eyes. So again, the cornea and the eyeball will remain moist. It will not dry up. So these are certain things you have to keep in mind. After the inoculation is done, the family is given an appreciation certificate by the eye bank, thanking the family member for doing a noble call, for the noble gesture. And that's all. Eye donation is very simple. You have to create a lot of awareness. And now we will come to the second important donation, which is as important as eye donation. That is skin donation. Skin donation, you will not believe, in a city like Mumbai, we require 2,000 skin donations per year. I am talking 2,000 donations per year, and we hardly get 10% of that. We hardly get 180 to 200 skin donations per year. Why this is happening? Because people are not aware about skin donation. They don't know how skin will be removed. If skin is removed, there will be a lot of bleeding. From where they will remove skin. So skin donation is also very simple. Like if some family is willing to do skin donation, first they have to arrange for the death certificate. Once the death certificate is sent to the skin bank will send the doctors and the technician to the family, to the person's home, or if the death has occurred in the hospital, it will be sent to the hospital. Now, the skin which is taken, the skin which is harvested, it can be stored for 5 years. This is the organ which can be stored for the longest period. And the shortage is so much that the skin which we donate is used within 45 to 50 days after all the processing and all is done. And this skin donation is useful for people who have sustained more than 50 to 60% burns, because these people will require skin grafting. And for skin grafting, the skin which we require will be obtained only if somebody does skin donation, because the graft which are available in the markets are very costly, which are out of reach of a common person. Again, Rotary has a very important role to play when it comes to skin donation, skin grafting. We have a lot of Rotary skin banks all over India. In Mumbai, we have at Airoli. We have a big skin bank at Airoli, which is affiliated with the National Burn Center. It is run by Dr. Sunil Kiswani, a very renowned plastic surgeon. He himself is a Rotarian, and he does a lot of work on skin donation. So Once the family gives the consent, they send the certificate, the team will arrive. In eye donation and skin donation, there are certain things to be kept in mind, that people who are suffering from diseases like HIV, hepatitis C, hepatitis B, or they are having septicemia in their body, then skin and eye donation is not possible. That's the reason we tell the family member to send the death certificate first. All these are contraindications for eye and skin donation. The skin donation team, the skin retrieval team, or the skin harvesting team, they will harvest the skin from the legs and upper part of the thigh. If required, the skin is taken from the back also. It is harvested by a small instrument known as dermatome, and the skin is removed in the form of bands, and these bands are immediately put in the solution of glycerol, and then they are carried to the skin bank. In the skin bank, they will do the processing of the skin, where they will remove the bacteria, virus, fungus from the skin, and within a span of 40 to 35 to 40 days, the skin grafts will be ready. And this skin graft will be then used for grafting on burns patients who have sustained major burns. By doing skin grafting, you will be increasing the immunity of the person, you will be relieving him from pain, and the recovery, the healing will be fast. There will be no infection in the wound. If a wound is left untreated, the person might develop sepsis, he may go into multiple organ failure, and ultimately the person may die. So skin donation also is equally important like eye donation. It is also very simple. And after death, as I told you, two donations are possible. Once your family doctor certifies that you had died, then the family can think of doing both these donations. Again, like eye donation, the skin donation, the skin bank will also issue a Thanksgiving certificate. They will appreciate the gesture done by the family. And again, as I told you, the demand is very high, and what we get is on the lower side. So awareness and prevention, awareness and motivation. These are two things which will definitely increase the number of donations. So we have completed eye and skin donation. If you have any questions, then you can just open out. Then we will take the remaining two subjects about body donation and organ donation.
Thank you very much, Dr. Trivedi, for giving the your views on eye and skin donation. Dr. Trivedi, as you know, that Rotary Club of Organ Donation International is a international e-club, and it's a cause-based club, and we have members across the world. Now, when we are talking about eye donation or even skin donation, both the things, the problem in India is that we are not having a proper infrastructure, or otherwise, I can say the eye banks and the skin banks. I will give you example. UP, Uttar Pradesh is the biggest state in India, having 80 districts, and not a single district is having a skin bank till date. It's a very pathetic thing. In India, 27 skin banks are working, and there is not a single skin bank in Uttar Pradesh and Uttarakhand. So all the skins which are being generated there are going waste. Similarly, the eye bank, there are no eye banks, and that is why the people we are having this shortage. Because what you are talking about, Mumbai, yes, Mumbai is having very good infrastructure as far as the eye and skin are concerned, apart from organs. So, but until unless we not create this infrastructure, so my question to you is, why Rotary International is not taking up this very seriously when they have done the work for polio, to end the polio? And although the polio, as you know, it's so far only for the countries like India, Pakistan, Afghanistan, or these types of countries, not in that much in developed countries like United States of America or UK, etc. Similarly, the problem of all these eyes and skin as well as the organs are mainly in India. Not even our neighboring country, Sri Lanka, as you might be knowing, the donation is the maximum in Sri Lanka, and they are exporting the eye corneas. What is the reason? Apart from, yes, awareness is not there, fine. But 85% for organs, I can authentically say that 85% of the revenue district doesn't have an organ retrieval center. Skin bank, when there is no skin bank, tell me how we will be able to donate skin at in a city like Mathura, Agra, Aligarh, any other places. Even in Maharashtra, only you can say few cities which are metro and class A cities. Other cities are not having infrastructure. And as you said, the 6 hour is the window. How is it possible that somebody will give a call and somebody will rush from Mumbai, go to Amravati or somewhere? It's not easy to reach there within that time. What do you say about this, Dr. Trivedi?
No, so first of all, as you rightly told, we should each, especially I had gone to Uttar Pradesh in Gonda before 5 years to give a talk on eye donation, organ donation, and skin donation. But as you rightly told, the infrastructure's availability is not there. So if we talk about donations also, where will the family go to donate the skin and eyes if they don't have a proper eye bank or skin bank? So I think Rotary International, along with we should work with the we should talk to the government authorities that at least you come up with these basic facilities so people who are willing to donate, then things can happen. But if you don't have infrastructure, things will not work out only. So Mathura, Uttar Pradesh, Jharkhand, all these are places where you have to do a lot of revolutionary things, where we have to talk to the higher authorities to set up all these things.
Okay. Thank you very much, Dr. Trivedi. Any questions? Now I'm opening the floor for everyone. Whosoever wants to ask, they can ask, raise the hand or unmute themselves. Yeah, Rotarian Hemlata ji, yes, please ask.
Good evening, sir. It was a very interesting session. And you told for the eye, it is for 1 month to 80 years. I mean, age limit. Age limit you told for eye donation. You told for 1 month to 80 years. For skin donation, what is the age limit?
It is from 17 years to 100, more than 100 years. Only thing in skin donation, the weight should be more than 50 kg. There should be no psoriasis, and there should be no major, as I told you, no septicemia, no HIV, no end stage of cancer, metastasis. Like otherwise, skin donation can be done up to 100 years.
One more thing, sir. When you remove the skin, do the organs also come out?
No. We are
1/8, 1/8, like.
No. We are taking the skin only from the legs, and if required, from the back. So the organs will not come out. They will not hang in the air. Don't worry about that.
Okay.
Once you see a skin donation happening, you will motivate other people to donate skin.
So different team is there for eye as well as in skin?
Yes.
Different team.
There are 2 different teams.
Okay. Thank you.
Thank you very much. I saw the hand of Deepak Agrawal. Rotarian Deepak Agrawal, please, ask your question.
Sir, good evening. My query was, is it possible you can share some pictures when the eyes and the skins are removed from the body, so which can be better way convinced to the family? The face won't be changes. The face will be the normal face.
Okay. I will do one thing. I will share the pictures with sir, so he can.
I will put it in the group. Yes. I will do that.
Because I thought that when the eyes will be removed, so
the person will look normal, like he is sleeping. There will be nothing wrong with the person.
Okay.
We do it in a very systematic way.
Okay. Great.
As Dr. Trivedi has explained that earlier they used to remove the complete eyeball and all things, but now only
remove the cornea.
Cornea only. So that's why. Once he will send me the picture, I will put it in the group.
Okay.
Yes.
Thank you very much. Yes. Other question, please. I know today match is going on, so people are waiting that how fast we can finish our meeting. But still, I can tell you the score is 135 for 3 and 29.4 overs. So still, we are in a good position. Yes. Any other question? Otherwise, Dr. Trivedi will take the next step. Dr. Saran, you want to ask any question, or you are more keen in match? Dr. Saran.
Good evening, sir.
Yeah. Yes, please ask. Dr. Saran, please ask your question. Please unmute
Thank you,
yourself.
Dr. Trivedi, for the very enlightening presentation. And in India, there is attitude issue with respect to tissue donation, blood donation, as well as organ donation. Do you think doctors have a way to persuade us to change our mindset?
Actually, we have to create a lot of awareness amongst the medical fraternity, because they are the people who can really make a big difference. Because if the family members tells the family to donate eyes, donate skin, the family will definitely do it. So family members should motivate each and every, if there is a death, he is issuing the certificate, he should mention to all the family members that you please do both these donations. So they have a very important role to play.
Thank you, Dr. Girish.
Thank you very much, Professor Rotarian Professor Dr. Sudhir Saran. Any other question, please? Okay.
Sir,
So,
good evening, sir.
yes. Please ask.
This is Vinod Kumar from Ooty. Good evening, sir.
Yeah, good evening, Mr. Vinod. We can't see you. Can you switch on your...
Yes, actually, I'm having some network issue. I'm in the estate now.
Okay, no issue. Please ask the question.
Just wanted to tell a very, very good evening to all and all. And this meeting is very useful. And my question is, I've been speaking to people like past 15 days about organ donation and stuff. And my question is, if they are below 18, do they need the permission from the parents, or they can very willingly they can do it?
No,
Okay.
Skin donation, as I told you, skin donation is done only after the age of 17 to 18. But eye donation is possible for young people also.
Because this eye donation is done only after the death. So, yeah. And if you are talking about the organ donation, which you have mentioned, no, it is not possible even with the parents' consent to give below 18. Only the courts can give the consent in a special case. Otherwise, there is no power. Even the government cannot give the permission that you can donate after below 18 in a living condition.
Fine.
Yes,
I think I'm
that's
okay.
right.
Thank you.
Okay, thank you very much. Yes, Dr. Professor Rotarian Dr. Rohan Monis.
So good evening, Trivedi ji.
Yes,
sir. So with respect to the medical fraternity, I mean, because I'm also a medical doctor, I'm heading a hospital here in Mangalore. So what is happening, sir? Like the awareness of the whole holistic issue about organ donation is missing with the medical fraternity by and large. So what has recently also happened is there's something called as Indian Society of Organ Transplantation. They've had a meeting with the DNB head and also the NMC head, asking them to make organ donation, the story around organ donation and the medical and surgical aspect of it, a part of the PG program. And I've written to them saying that why can't you make it a part of the UG program also? At least give them an understanding, because we have a lot of family physicians. But sir, I think it happens on the training level, because many of our doctors who are post-MBBS, even post-MD, don't talk about it, because even the teachers don't talk about it, sir. And such awareness programs, when we actually bring it by and large, because primarily for training, they actually go abroad. There are a few centers in India which actually impart such sort of a training. So I think, sir, through our platform also and through your platform, this is something that probably we can work through to the Indian Society of Organ Transplantation, encouraging them to, have something around organ donation every year for the students, sir. That's the way you can have mass capitalization of, mass understanding of the medical capital. NATO will be a difficult situation. Your view, sir?
Yes, it is. I completely agree to your views. There should be a lot of awareness to the medical students, postgraduate students, and mainly the doctors who are working in the ICU when it comes to organ donation, because they are the people who will declare the person brain dead. They will motivate the family for doing organ donation and all. So medical community, there should be, it has to be, it has to come into the syllabus and all.
Thank you, sir.
Thank you, Dr. Monish. Don't you think, Dr. Trivedi, that instead of going into the medical, why not we start the this curriculum right from 5th or 6th standard with a very small portion, initial things, and then gradually we must start giving more and more inputs, so that the student who is in 5th or 6th standard, when he reaches home, he or she will ask the parents what is organ donation. That definitely the parents will also come to know by this way what is organ donation, and they will understand, and then they can only explain the children. But if we will be only doing at the level of a medical student or a postgraduate MBA student or something like that, then we are we are not educating the society at large. We are just educating the students of a postgraduate or undergraduate. I think the best thing is
I fully agree with you, because I give a lot of talks in schools and colleges, because and I even talk to educational institutes also, and I am in some committees also of some educational institutes. I talk them to include small chapters on organ donation, to bring it in the curriculum, so that from the young age the people will start knowing about all these donations.
Because I consider that this generation, which is say 10 years onwards or 12 years onwards, they are having lots of information because of the social media today.
And yes, social media will play a very important role even in creating awareness for eye, skin and organ donation.
Yes, please. So when they are having information, only thing is we have to convert that information in the knowledge. And that is only possible if they will go to their house, ask the questions to the parents, what is organ donation, what is eye donation, what is skin donation. Definitely the parents have to study, they have to see what is that. They may ask the school teachers, see the child is asking this, and they have to study. And it means we are by educating or by putting one student under this particular curriculum, we are educating the entire family, at least the parents, and then it will go to the society. So that is why I have done some recently, the last month only in the Chennai, and this month I am going to Uti for giving the lectures in school and colleges. And that is what I want to give reply to Mr. Vinod Kumar, if he is listening to me, because his reservation is that the students are not having that information, although I believe that they have more information what we used to have, because we were not exposed to any mobile phone or any social media in our time. So that you also agree that the social media can play a very, very important role as far as the organ and tissue transplants are concerned. Dr. Trivedi.
So awareness at all the levels is important. You have to do awareness for all the sectors of the society. And as you rightly told, if we target youngsters, it will make a difference in the near future. It's a very important and very sensitive issue that, and unfortunately, people don't take it so seriously. That is the problem.
Yes. Mr. Rotarian Ramnath Pradeep, would you like to ask any question, please?
I would like to ask only a very simple question. Dr. Monish has raised very valid questions that there are many doctors. My question is, there are many doctors in the Rotary. Every and a large number of Rotarians are there as a doctor. If the Rotarians as a doctor can take this as a mission for creating awareness as well as among the doctors' family, among the doctors' fraternity, this will create a lot of impact. I find that even the doctors in the Rotary are also not aware of, many of the people are not aware of, and they are not taking the matter seriously. So my appeal to all the doctors who are Rotarian, they should also take it as a mission that the organ donation or tissue donation or eye donation should be taken as a mission. Is it possible, Dr. Trivedi, or not possible?
Yes, doctors, as I told in the beginning also, doctors have a very important role to play, because recently there was a column in the death certificate, eye donation, skin donation. If the family gives consent, they have to write in the certificate that the family has given the consent for eye donation and skin donation. So there are a lot of other methods also where we can motivate the family members to donate to do both these donations, because a lot of people are not aware about all this, because they have heard it from somewhere, but when the time comes, we miss out a lot of eye donation and skin donation. Either
Dr.
if the
Trivedi,
person,
my very limited question is there are a lot number of doctors who are Rotarians. I know there are many doctors Rotarians. They are associated with the hospitals, they
so
are
they
associated
should
with
take,
the
they should take
colleges,
the
they are
initiative.
associated with the various other organizations.
What I'm
Why
telling,
can't they take as a mission?
they should take the initiative. At least they should create a lot of awareness programs.
So what Mr. Rotary Ramnath Pradeep is saying, why Rotary International or Rotary District is not making it mandatory for all the doctors who are in Rotary clubs to be aware about organ donation, and then they should go and create the awareness. Is it correct, Rotary Ramnath Pradeep?
Correct. Because there is a large number of Rotarians who
No,
are doctors.
I will go a step further. They should not only create awareness, but they should make the things happen.
Correct.
Whenever they come across some means they know that somebody very close to them has expired, then they should put 100% effort that the thing happens.
Correct. But why not happening?
Why the Rotary
should not take? Why the Rotary should not take as a? I'm talking about Rotary International should take as a mission, like like any other project. That all our Rotarian doctors who are there as a doctor, they should take this as a mission.
We have to keep on pressurizing them that you have to work in this, like they worked in polio. They have to take up this as a very important subject.
Dr. My point is only, why can't be taken as a project as an international level?
We should definitely.
The reason is that this problem is only majorly in India, not even in Middle East, not even in other countries, only in India. So India, and we know that like today, I received so many messages why you are keeping the meeting on a match day. So our commitment, we have to see, but I am very happy to inform that today, in spite of the final match, so many of our Rotarians have joined it. This shows their commitment to this cause. So what Rotarian Ramnath Pradeep wants, that this commitment should be also be shown by the Rotarians, at least the Indian Rotarians, so their pressure can go to Rotary International. Until otherwise, it's not possible by one club or two clubs or few of the speakers like you to create awareness, and then there will be no work.
What he has suggested, that the medical fraternity has to take this very seriously. They have to take it as a project. They have to take it as a mission, because they are the people who will make a difference.
Correct.
Okay.
Do you agree, doctor?
Yes.
So let us start.
I am already working in this field for last 14 years.
I am talking about when there is always a meeting of the presidents of all the Rotary Club. Internationally, sometime in Indian Rotary Club recently it has happened. The conference has happened, but nobody has spoken on this.
No, see, I will tell you
the
recently in the district 3141, one speaker, he is an ex hockey captain and the ex sports minister of Haryana. He spoke about organ donation, But unfortunately, as you rightly said, Rotarian Pradeep, nobody takes it seriously unless the district level will not take it seriously. You cannot put pressure on Rotary International. And for that, the awareness is required, more and more awareness. People are doing, like Dr. Girish Trivedi is talking to many of the Rotary clubs. He is giving lectures. There is one Mr. Sardarji Singh, Mr. Singh, Rotarian Singh. He is giving his lecture through his foundation. We are also creating awareness through other many of the clubs. But only thing is, unless it will be taken very, very seriously, it's not possible. Anyway, so thank you very much, Rotarian Ramnath Pradeep, for your things.
Thank
Now,
you, sir. Thank you, Doctor.
yeah. Any other questions by anyone? Yeah. So, Dr. Trivedi, you would like to say anything further about
I will
organ
just
donation?
brief them about two more donations. One is body donation. A lot of families, they want that we will donate the whole body after the person dies. So body donation is basically for medical students, and when they are taught this human organs structure and study and all, they have a subject known as anatomy in the first year of MBBS. So that is the time when the medical students are taught on a dead body. So in remote places, there is a lot of requirement for dead bodies for the medical students. But in a city like Mumbai, there are a lot of body donations happening, and there is not a shortage for students to undergo studies during anatomy subject and all. So body donation also, if somebody wants to donate the body, they should first donate the eyes and skin at home, and then send the body to the government or BMC hospital. So body donation is also very
Dr.
important.
Trivedi, in body donation, the problem which even Rotarians have faced, one of the Rotary club I was addressing, and they says the problem is that the body has to go to as you rightly said, the government or through the BMC, Municipal Corporation Hospital. Now, there is a time limit. They says now it's 5 o'clock, we are closed, you come tomorrow. Now, who is going to hold the body whole night?
Technical problems. So ultimately, the family decides not to donate do body donation.
So unless we will not make it 24/7, because death can happen anytime. And you know, after the death, people forget, no, Mr. Goyal, only a body. When we will send the body, the name, the person lose the name once it is the person is died. So when is death? Sorry?
Remove the body as early as possible.
As early as possible. So, but leke jao, but if you want to donate and if the hospital says no, what is your experience, Dr. Monis, in Mangalore? You are also having the same problem or not?
So what is happening, sir? So we've got quite a few bodies coming from old age ashrams to us. Like there are some destitutes or there are some old age ashrams which the bodies are there. So in case they wanted healthcare, we were helping them for a free of cost. But what happens is once that old person dies, so the ashram authorities take the consent from the family. They said, we don't want to spend 10,000 rupees also to do the last rites. Please donate the body. So they write on a paper, they take a death certificate from a local doctor and they give it to us, and the body comes to us. And so through these bodies also we've done eye donation, to be honest. I'll tell on this forum, like, you know,
the problem which people are facing is that the night, people are not accepting the body, and death can happen anytime, in the evening, afternoon, and when they decide, they say 6 o'clock or 7 o'clock. Is your hospital accepting at 10 o'clock or 11 o'clock the donation or not?
No, so what is happening is the problem is lack of acceptance is primarily because of lack of a death certificate. So for any procedure to go, so what happens is once that body is registered as a death coming from a registered doctor, a registered medical practitioner, that can be shown in the municipality tomorrow for any other paperwork. So if the doctor clinic is closed, maybe a private clinic or even a government hospital, you cannot proceed. Honestly, is that for a want of a death certificate, you just close that problem. So just close that gap of a death certificate, things can proceed.
No, you mean to say if the death certificate is there, so there is no problem for taking the body by an hospital?
Yes, sir.
Is it correct, Dr. Trivedi, your experience in Mumbai?
In Mumbai, again, the hospital authorities, they are not very cooperative, what I have found out. at night time and all, they don't pick up phones, or they will tell now it's too late, you call us in the morning. So it's a problem, and again there is a time limit. You have to they will always tell that bring the body within 8 to 9 hours.
Yes.
And death certificate again is very, very important. If you don't get the
that's the most important document, sir. So what is happening is some of the hospital authorities actually are proactive and also facilitate the use of the mortuary. So they keep the body in the cold freezer till morning. The other department fellows come and then they hand it over. Even that happens. But so what is happening? There is something called as the Anatomy Act. So for a medical college, for the Department of Anatomy, there's something called the Anatomy Act. So उस Anatomy Act के अनुसार हम लोग को जाना पड़ेगा. So those papers get filled. That's it. And it's a legal.
Okay, thank you very much. Any other question? Rotarian Deepan Shah, can you hear me? I know that
Sir,
you are
I've got a
watching
question,
a TV, you are watching the match. Yes.
I'm here.
Yes. Now, Rotarian Deepan Shah, he's from USA, and he's trained skin on the tissues retrieval. He has done he has taken a degree or diploma from there, and he mentioned to me when I met him in USA that there is a 4 years degree course for a retrieval, which he is going to explain more. But my question, after he will speak, then my question to you will be: in India, there is no such courses prescribed by the government, only for 15 days or 1 week or 3 weeks course, either at Airoli or anywhere, and the person is trained. But in USA, they are been trained for 4 years, and it's a degree equivalent to any other paramedical degree. So, Rotarian Deepan Shah, can you just explain about that thing?
Yes, thank you very much. It was a wonderful questions. The setup system here is different. Every profession required to have a certificate or license to the affiliated institute, college, university, or in a professional career. You can go through there. In our case, in my case, I get my tissue recovery specialist certificate from AATB, American Association of Tissue Bank. I get a lot of credits because of I have other multiple degrees. So still I study for, in my case, I study for 1.5 years. And then I had passed the professional exam through the AATB. And then after I certified training for 6 months, and then I'm in the field for so many years. And now I'm a department head for J&J for tissue recovery specialist, especially in human skin, musculoskeletal, ligament, and tendons. So Indian system, I don't know about that, but here you have to have either degree and experience, but still you have to pass through the professional certificate license through the affiliated institutes. And in our case, J&J has their own university also, so we have a continuous education through our university also. Hopefully, I give you clear answer.
Okay, Dr. Trivedi, what you say about this? That you have seen that in USA, so many years they have to spend. They have a university dedicated for tissue things, and they are. But in India, I discussed with many. Even Dr. Keshwani also came on our show and on our meeting, and he also said that only his certificate, which he's giving, it's approved by the NOTO, and
they are having 3 weeks or 2 weeks training courses, and it is mostly a lot of doctors. They are not enrolling themselves. It is only paramedical people or other people who are enrolling themselves. They become technicians, and then they come for the skin donation cause.
So don't you think this is one of the reasons people are afraid to give the skin donation, because they feel that they are going to a quack? I will use the word quack. He is not a properly trained, not an educated person, just a person who is going to remove the skin, not in a scientific way, because he is not qualified to do that. Don't you think that as a doctor yourself, as a Rotarian, we must take this matter to the NOTO and SOTO and the government, that they should have a proper trained staff for retrieving the skin, at least, or even the eye.
I agree with you 100%.
I can see the hand of Mr. Vinod Kumar raised. Yes, Mr. Vinod Kumar, your question, please.
Yes, sir. Sir, actually, I'm from the Nilgiris district.
Six Mari. I believe meeting jara.
Yeah, Mr. Deepan Shah, can you just mute? Yeah, please go ahead. Yes, Mr. Vinod Kumar.
Sir, I'm from Nilgiris district, Tamil Nadu. The nearest cities for us is either Coimbatore or Mysore in Karnataka. And if anything has to happen, we have to travel at least 3 hours. So how can we, move about this, sir?
Regarding for what?
For any sort of donation,
No,
whatever
but
donation.
you in Uti, you have a medical college who is doing the transplant
Yes,
now?
Yes,
so,
sir. Yes, sir.
So you need not to go anywhere. You can go to the medical college. They will take the, they can retrieve the organs if it's a brain death, and if it is a natural death, then they can retrieve the tissues also.
Fine, sir. Because as we spoke the other day, there's only 2 transplants that has happened in the past 2 years.
No, that is what Dr. Trivedi is saying. Lack of awareness.
So that's what. Yes. So
we have no awareness.
We need to travel. So just that's.
No, because nobody will take the body for 3 hours and give it to Mysore or go to Coimbatore. They have to give to the nearest place only. That is correct. And as far as the tissue and eye donation is concerned, they will also not take the body and give the donation there and then bring the body back for the cremation. That is also not possible.
The team will have to train doctors or train technicians will have to go to their homes. They will not bring the body.
But Dr. Trivedi, here also there is a difference in USA. Mr. Deepan Shah, I would like you to take the attention for again. In USA, the skin retrieval is in hospital. Is it correct, Rotarian Deepan Shah?
Yes, very correct. It's in a surgical place, hospital, and class 1 ISO places only. Not at home, not at other place.
In India, it's allowed at home, but they never allow such type of retrieval of skin. Even I also, Rotarian Shah? Rotarian Deepan Shah?
Sorry?
Even I also to be retrieved in the hospital?
Absolutely. Yeah. Very true.
What you say about that, Dr. Girish Trivedi?
In a city like Mumbai also, people will not take the body to the hospital. They will, first of all, once they are convinced, they will want all the things to happen either at their hospital or at their residence. To take the body to the hospital, it is very difficult. The facilities are not there. No, we can carry the body in the ambulance and all, but again, this will not work out.
The mindset has to be changed, or we have to show the facilities that at home or doing at hospital is totally different.
So I have a question to Dr. Trivedi. Yeah, how do you maintain aseptic techniques, right? When you're doing at home and when there is no clean environment.
No, regarding aseptic techniques and all, it is all these eye donation kits, skin donation kits, they are all sterile. Because once they remove the skin and eyes, it is all done under aseptic, means all things are properly fumigated and all. So the chances of infection are almost zero.
No, that is correct, because that is done by the expert using the sterile instrument in a aseptic manner. But the environment, right? You go someone's home.
No, environment it is not an issue. Actually, this is not an issue.
But what I understand, because once, suppose example skin, once you recover skin, we not allowed to use any kind of antifungal, antimicrobial, or antibiotic unless it is removed for skin for burn. Nystatin we allowed to use. I don't know about India. Once they retrieve the skin, what kind of preservative and antibacterial solutions they use?
Mostly they immediately put the skin in the glycerol solution. That is one of the best preservative solution for skin. And once the skin bank, then there are a lot of safety measures there.
But do they still, what I understand, so every country has their own different guidelines. And we in USA, we don't allow certain antibiotics. So in India, I believe they allow to use certain antibiotics also.
I think Dr. Keswani He has opened up a lot of scheme banks and all. So he is the right person who can give a lot of detailed information on this.
Okay. Thank you very much, Rotarian Deepan Shah. And I
Thank
think
you.
we have taken lots of time in the full meeting. So over to you, Rotarian Ruby Agrawal.
Thank you so much, Dr. Girish, for giving a great insight about the eye, skin, and body donation part. A lot of us were not aware of a lot of other things. And thank you all for attending today's meeting in spite of the final match of India cricket match. Thank you, Dr. Girish. Thank you, all Rotarians.
Meeting is